So we talk often about leadership and the mind of the scientist, that as the world gets more complex, you can't go to best practice from 5 years ago and solve the problem the way we used to. Some you can, obviously, but many of them, those solutions, while brilliant at their time, no longer brilliant. And so it sounds like head of research into a CEO role in the way we talk about leadership is a very useful next step. And yet, I imagine you had many people in place who were uncomfortable with the research thinking in running an organization because you're supposed to have answers and tell us what to do.
So it's interesting because it brings together a lot of themes here that are so important. Number one is the narrative that we've always done it this way, and therefore we need to continue to do it this way. It can be a very powerful disincentive for change. If you're thinking about things from a research perspective, you're always thinking about where are you going and why are you going there? What are the questions you're trying to answer? What are the teams around you need to do to confront problems? So embedded in all of research and innovation is bringing a multidisciplinary voice. You have to have a multidisciplinary voice. You have to have different people from different backgrounds. You could have in science someone who's a chemist, someone who's a biologist, someone who's an endocrinologist, someone who's a geriatrician. You can do all of this. But fundamentally, you're bringing together teams of people with different expertise, different voices, and different perspectives, and have them share a common vision. So I think one of the really first things in becoming CEO is to try and create what that common vision was. Where are we going as a healthcare system? And then I'll get a bit to your question about how do you think differently and what are those disruptors that really force people into thinking in a different way about change? So, for us, it was how do we take this Mass General Brigham, which at the time was Partners Healthcare. So it was a number of very, very recognized individual institutions. We had Mass General Hospital, Brigham and Women's Hospital, these three renowned specialty hospitals, McLean Psychiatry, Mass Eye and Ear, Spaulding Rehabilitation, these community hospitals, urgent care, lots of different things in ambulatory sites, an insurance company, all of these things. How do we take all of these things together and say, what is it we're trying to do here? And that is where it was, how do we gather all of these powerful entities, expertise, hospital, everyone together to really create the integrated academic healthcare system of the future with patients at the center. So this is where I wanted everyone to come together to think through. How do we deliver care as a single integrated system that leverages the best of everything, the capabilities, the expertise, focusing on patients to enable patients to access the system, to navigate the system, so that this whole full continuum of care that we provided was accessible to patients. If you think about this system too, it's research, it's innovation, it's that highly specialized tertiary quaternary care that helps define us. So it's sustaining that excellence in research, innovation, teaching, complex care. What are those things that bring people to the system? And how do we best deliver that care that's informed by that research and innovation? Don't splinter these capabilities. Put them all together to create something bigger than what we are.